And welcome back. Children of Promise NYC is a community-centered organization partnering with children and families impacted by mass incarceration to dismantle the stigma and also heal from the trauma that has been plaguing Black and Brown communities. And since its inception, they've provided services to over 1,500 children as well as their families. We're pleased to have joining with us the founder and the CEO of Children of Promise NYC, Sharon Content. And thank you so much, Sharon, for being with us.
Oh, my pleasure. Thank you so much for the invitation.
Yeah, and I think it's a conversation that we need to have because we talk about children and families, and particularly when it comes to the issue of mental health and services, something that's very much needed. And so your organization is at the forefront and really has boots on the ground. Share with us a little bit about the work that your organization does.
Okay. Again, thank you so much for this invitation. Children of Promise NYC, I founded this organization in 2009, and it's a very unique and innovative model. Our mission is to support and advocate children of incarcerated parents while speaking against the root causes that affect communities in which our target population lives. We conclude systemic racism, poverty, biases in the national criminal justice system. So our innovative model combines a licensed outpatient mental health clinic with traditional comprehensive youth development. It's a program that centers around family engagement. So not only are we working with the scholars between the ages of 6 and 18, we're also working with their caregivers, their grandparents that are now raising their grandchildren, foster mothers, caregivers, single parents, moms, dads that are now raising children that have an incarcerated parent.
Yeah, and so as you have an incarcerated parent that's there's a lot of challenges that actually are on the outside for those who are, trying to deal, see, and be able to, just stay in contact with their loved one. Talk about how you're bridging that gap and what that means for you.
Sure. So our model is one that believes in the connection to the imprisoned parent. So while we are providing those traditional services and we infuse mental health in all aspects of our program, we are also respecting that relationship of that scholar and that imprisoned parent. So part of our programming includes writing letters, sending report cards, pictures, drawings, any way that we can connect that scholar and maintain that most important relationship between a child and their parent.
Yeah. I know that mental health is pretty big when you talk about the incarceration population. And also when we talk about dealing with our youth. When we talk about Black, Brown youth, barriers exist. We want to be honest about that. But you're also trying to do some things in terms of tearing down those barriers so that way access is
we are looking, our organization is designed so those barriers that exist, we embrace our families where they're able to share the challenges that they're dealing with as a result of raising a child that has an imprisoned parent. Again, how are we eliminating barriers so that our families feel comfortable in sharing the challenges? And then as an organization, we're providing comprehensive services so that we can allow our families to deal with those challenges. How are we supporting them? Partnering with other agencies in the community, we're able to provide each family by family, case by case, scholar by scholar, really identifying the needs and the barriers, and then how we as an organization are coming together to allow them to embrace and deal and also to be able to confront so many of those challenges with the support of an organization. And that might mean a counselor, your clinician, an administrative staff. We are really working together to support our families to deal with so many of those barriers that exist.
Yeah. And so for somebody who doesn't know what are some of those barriers, give us some examples of what they may be.
Oh, well, the barriers can exist, again, in the wide range. The barriers can be, first, how are they remaining connected with the criminal? How are they remaining connected with their imprisoned parent, with that incarcerated loved one? The barrier that exists in working with the criminal justice system. That's number one. How are we helping families to be able to remain connected to support that incarcerated family member? The barriers around housing, food insecurity. As a result of the pandemic, we have had a new range of challenges and barriers that our families are dealing with. As a result of living in poverty, our families are dealing with lacking in educational levels that we are now supporting our families that are working with the Board of Education. And how are we supporting our students? How are we supporting our scholars with learning loss? These are barriers that exist that we, as an organization, Children of Promise NYC, are providing comprehensive services to support our families in dealing with so many of these issues.
When we talk about parents that are incarcerated, obviously for that parent that's incarcerated, there's a lot of concern. And there's a lot of concern that goes out there on behalf of their child and their loved ones. But if you're a child of someone who's incarcerated, that's a heavy weight on the heart. And so that's a burden that kids are dealing with. And whether or not we pay a lot of attention to it is up for debate, because some people say, yeah, when it comes to kids, we understand all that a child is going through. But then the reality is that there's a lot of trauma. There's a lot of pain that goes into that child when they're really dealing with somebody that's incarcerated. So give us some insight into your organization, because you do try to help youth who have got parents who are incarcerated. And how do you try to bridge that gap so that way the youth and that one that's incarcerated can actually maintain that better relationship?
Oh, first of all, absolutely. Maintaining the relationship is paramount. But first and foremost, we acknowledge the trauma that exists in having an incarcerated parent. So while parental incarceration is recognized as an adverse childhood experience, we recognize it, and at our organization, our model is designed so that not only are our scholars able to come together with other scholars who share similar experiences, so they understand what it means to drive 6 hours to visit mom or dad behind a plexiglass. What does it mean that mom called collect and you weren't able to tell them about what was going on in school today because the collect call disconnected? We have experiences that scholars understand. So we create a safe space for our scholars to be able to share those experiences under the facilitation of our clinicians. One thing we recognize is that when a child loses a parent as a result of divorce, let's say military deployment, or even death, there's a level of sympathy and compassion that child receives. Whereas if a child that loses a parent as a result of incarceration, that same level of empathy doesn't quite exist for that child. So what we're doing at Children of Promise is really understanding the loss, the depression, the anger, the anxiety, so many of the emotions that our scholars are experiencing as a result of having a parent in prison. So first, it's acknowledging the trauma, and then how do we confront that with our scholars and their families? So it's providing the clinical services so that our scholars are able to, again, have safe spaces to express some of those emotions, as well as designing and training staff to understand some of the behaviors that might be expressed on a day-to-day. A child might be coming in having a really tough day as a result of maybe someone said something at school that really has triggered that particular child. Our staff is trained to understand those behaviors, and how do we allow our scholars to be able to learn positive coping mechanisms to be able to deal with so many of the emotions that they're dealing with that they might not be able to express and talk about anywhere else. Because as you know, there's a stigma around having a parent that's in prison. There's a secret around having a parent that's in prison. So how do we create a safe space for our scholars to be able to walk into the building, understand that other scholars share in that experience, and then having the staff to be able to allow them to deal with it in a very positive manner?
Yeah. Sharon, I know that also some of the work that you do in terms of bettering the lives of our young people is really attaching them with mentorship, and mentorship is key and critical. So give us how your mentorship program is going and the role of mentors.
Sure. So our CPNYC Children of Promise mentoring program is called Project Dream, which allows children of incarcerated parents between the ages of 6 and 18 to be able to be matched with a mentor. That's another adult that is screened and trained. There's an extensive process that a mentor has to go through, or a prospective mentor has to go through before they're approved as a mentor. And that particular process allows a volunteer to be able to learn so many of the mechanisms that we introduce as an organization to be able to work with the scholars as a mentor. So our mentoring program is a 1-year commitment at least 1 hour per week for 1 year. And that hour can also be spent at Children of Promise NYC at our after school program, September through June, 3 p.m. till 6:30 p.m. or during our summer camp from 8 to 5 in July and August. So a mentor makes a 1-year commitment to be matched and trained, screened and trained before they're matched with a young person, a scholar at our organization, and being able to not only create a relationship, but to work with our team. You're working with the clinician, you're working with the counselors hand in hand. We're collaborating to make an impact on this young person's life.
And when we talk about the role of mentors, having an impact on somebody's life is huge. What have you been able to see and what have you been able to share about the role of mentors and how it's impacted these young people in your program?
Well, I can say that by just demonstrating the number of relationships that expanded or extended beyond the year. So many of our mentor relationships do not end at that year mark. We've been able to expand and extend that relationship to also include not only maintaining the relationship, but the connection to the organization. Being able to allow a mentor to have a relationship with the scholar, with the organization beyond the 1-year time period that they have committed to. So that also that really demonstrates the commitment of our mentors. But then also we have mentors that have really connected with the organization in so many other ways, that not only with the relationship with the mentor, with their mentee, but then they've also become volunteers in other aspects. They've become donors, they've become supporters. They've really supported the agency in so many other ways. And then the relationships, they've been able to work with their mentor and exposing them to so many experiences that our mentees come into the building on Monday morning after having an experience or a trip or an activity with their mentor over the weekend, and really just raving about spending time and learning so many new things, being able to have trips to museums and movies and so many other experiences that our mentees share when they come into the building after having that relationship with the mentor. So it's really been a very rewarding, not only for the mentor, but for the mentee as well.
Yeah, you got some creative arts that you also engage in, and with those who are involved in the program. Talk to us about the creative arts component.
Well, creative arts in co-locating an after-school program with a mental health clinic, we infuse mental health in all aspects of our program, and in the creative aspects as well. So that's art therapy. That's music therapy, drama, spoken word. So our arts, we infuse mental health in an aspect, in a way so that the arts allow our young people to feel and express what they're feeling. We provide activities and services so that our young people and our scholars are able to express some of this, again, sadness, anxiety, depression, loss, anger, as a result of having a parent in prison, but finding a safe space to express it creatively, artistically. So that is one of the ways that we are able to, again, infuse mental health into the creative arts aspect of our program. On top of being able to expose our scholars to so many, as I said, going into museums, plays, different artistic experiences that our scholars had not experienced previously. So our organization really infuses creative arts as a way, not only as a new experience, but a way for our young people to really express themselves.
Yeah. So as COVID is rampant and going for 2 years in our community, a lot of people have had to really deal with the devastating effects. How has the pandemic actually shaped and affected you and the work that you've done? Because the prison population is very much highly impacted with when it came to COVID.
Absolutely, in so many ways. First, I can start off with, at the start of the pandemic, as you know, or you may know, prisons ceased in any visits. So families were not able to physically see their loved ones that were incarcerated. So that was one of the initial needs that was brought to our attention. And then as a result, so the needs of our families then were also shared with us food insecurity, not only families members becoming ill as a result of COVID, where there was family loss. We had families that we served that lost members of their families as a result of COVID-19. So we really were able, as an organization, we created an entire initiative, CPNYC Cares, that was designed specifically to meet the needs of our families as a result of COVID. And that was distributing gift cards for food. We were delivering food. We also became a daily food distribution for grab and go hot meals for an entire period of time during quarantine when other government agencies and businesses were closed. Children of Promise was open on a daily basis with a number of other community-based organizations where we were working, and we maintained and kept our gates open and our doors open during that period of time to serve our families. And we had to very quickly pivot to provide services that we weren't traditionally servicing. We were not a food distribution program, but as a result of the needs of our families, that's what we had to do. Then we started working with learning loss. We were open from 8 to 3 p.m., again, pivoting from an after school program to a full day program for those families that were supposed to be having remote learning at home, but they didn't have the technology, they didn't have the Wi-Fi, the bandwidth, or the space to have remote learning from home. So we opened our buildings. We had approximately 115 students in our building that were able to receive remote learning on site. Then from there, we then had to pivot in another way, in that we are now providing virtual mental health for those families that are still not able to come into the building. And as a result of some of the difficulties we were having with identifying clinicians who were able to come on site, we now have virtual mental health where our scholars are able to receive the mental health services. Those that come into the building are able to log on and virtually receive mental health services from clinicians that are not on site. And then for those scholars that are not able to come into the building as well, we're able to connect them virtually with clinicians. So we've had to make quite a bit of changes and really pivot to meet the needs of our families as well as the needs of the workforce as it exists in 2022.
Yeah, Sharon Content been doing some great work. She is the founder and CEO of Children of Promise NYC. Sharon, it's been a pleasure having you here on the Social Justice Forums. Thank you so much for being with us.
Oh, thank you so much. It really was a pleasure being here. Thank you.
Great to have you. All righty. Well, listen, we want you to stay with us here on the Social Justice Forums. We've got one more guest, and you don't want to miss that. We'll be right back.